Thank you, Governor Burgum. Thank you for having me today. I just wanted to start off by thanking all of the epidemiologists and disease investigators that have been working really hard, even prior to seeing cases of COVID-19, in preparing and planning to see cases. And also I want to say thank you to their family members, because they maybe haven't seen their spouses in a while. And thank you to the family members for taking care of the household and also the children in the household during this. And then we also have had local public health departments and our health professional schools also offer to help us do case investigations, which we plan on taking them up on that in the very near future. So today I just wanted to talk about what happens when we get a report of someone who tested positive for the novel coronavirus, COVID-19, what that means at the Department of Health and what that means for the public and how we handle that. And so we get positive lab reports electronically. So as soon as it's positive at the lab, that is immediately sent electronically to the Division of Disease Control, and also the health care provider is one of the first people notified of the positive result. Then an epidemiologist from the Division of Disease Control contacts that individual, which we're calling a case, and interviews that individual. The interviews so far have been taking up to an hour. As a part of that interview, we're gathering information from the person, including basic demographics, but also what symptoms they've had, where they went in the 14 days prior to becoming sick, so we can try and identify the source of the illness, and then also where they've been, if they've been anywhere since they've been sick, and that's so we can identify close contacts or areas of concern that we need to follow up on. We also get their employment, if they attend school, anything like that. And then when we identify close contacts, and so a close contact is anyone that's within 6 feet for a prolonged period of time, and at the Department of Health, we're using about 15 minutes. And a close contact can occur if you're living with someone, so all household contacts are considered close contacts, but also if you're riding in a car with someone for a prolonged period of time, if you're working closely in an office with someone for a prolonged period of time. A close contact is not if you're in the same restaurant as somebody else that might have COVID-19. And so if you were eating across the table with someone with COVID-19, you would be identified as a close contact. But if you were just in the same restaurant, you would not be identified as a close contact. And so then we follow up with all those close contacts. And then we ask them questions about if they're symptomatic. We advise them to stay home for 2 weeks. That would be the minimum time period from the last time they were exposed to somebody with COVID-19. If they have symptoms, those individuals are being referred in for testing. We don't want them to go right to the healthcare provider for testing. And so we are coordinating that with the healthcare providers so they know someone that was a contact to a case is coming in for testing, and they're aware of that and can take appropriate precautions so we don't spread illness in the healthcare facility. We follow up with these individuals and monitor the contacts and the cases. The cases are monitored the entire time they're contagious, which is 7 days after their onset of symptoms, and they have to be fever-free and feeling better. The fever-free is 72 hours, fever-free without the use of meds, and their symptoms have to be feeling better. So the minimum time period is 7 days after onset, but it can be longer if they still have a fever. So we follow up with the contacts and the cases and check for symptoms and make sure they're staying home. And then we answer any questions that they might have or provide education. We have fact sheets that we give cases and contacts so they know how to prevent transmission in the household. If through our investigation we identify that someone was on an airplane with COVID-19, we notify the Centers for Disease Control, and they provide us with close contacts that were on the airline for us to follow up with. If anyone was in a ride share, we follow up with ride share organizations, and they tell us who the close contacts are, and we follow up with those individuals. So I guess the basic message I wanted to say, if you're a close contact to somebody who's been positive for COVID-19, you will receive a phone call from the North Dakota Department of Health or the local public health department notifying you that you're a close contact. And then we will inform you of what steps you need to take next. The reason I wanted to share this with everyone today is there's a lot of rumors on the internet, a lot of social media posts about restaurants or places where cases might have been. But really, we will notify everyone if you were a close contact, if you were identified through our case investigation. If it's a school or a daycare, we'll work with the school or daycare. We'll send letters out to all the parents. And so I hope this makes the public feel better about what we're doing to try to reduce the spread of coronavirus in North Dakota.